Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
700 million people. I mean, that's roughly the population of all of Europe.
Pretty much, yeah.
And that's how many people globally are dealing with low back pain. It's not just a small thing either. It's the #1 reason for disability later in life.
That's staggering, really.
So whether you're maybe feeling a twinge right now or you just want to understand, how to stay healthy down the line, this is definitely relevant.
Absolutely. And today we're really digging into a pretty promising approach that's got some science behind it.
Okay.
We've been looking at a health news report and also a detailed scientific paper as published in the journal Healthcare. Both are looking at this kinesiology-based method, kinesiology being the science of movement.
Right. So our mission today is to understand this new method. It's called the Canali Postural Method. You want to unpack, what the evidence says about why it might be potentially better than just standard exercises for that really common, non-specific low back pain most people experience.
Exactly. The study we looked at, its main goal was precisely that comparison. It aimed to see how the Canali Postural Method stacked up against a program of, let's call them generic, exercises. They wanted to measure the effects on pain levels, obviously, but also on functional disability, basically, how much the pain messes with your daily life.
Okay, so how did they actually set this up? What did the study look like?
Well, it was what they call a quasi-experimental controlled study. So comparing two groups, but maybe not with quite the same rigorous controls as some other study types.
Okay.
It happened in Naples, Italy during 2022. And they had two groups, 35 people in each. One group did the Canali Postural Method program.
And the other?
The other group, the control group, they did a program of generic exercises.
Okay, tell us more about the Canali method. What makes it distinct?
Right, this is where it gets really interesting, I think. The Canali Postural Method, it starts with a really deep, personalized assessment.
Not just jumping into exercises then.
No, not at all. They first evaluate the individual to pinpoint the specific musculoskeletal issues, the muscle imbalances, the tightness that might be causing the body to adopt these compensatory postures.
Compensatory postures, like making up for something.
Exactly. Like, if your ankle hurts, you limp. Your body shifts weight, compensates. This method tries to find those subtle limps in your whole posture system.
Okay, makes sense.
And based on that assessment, they create a tailored exercise program. The exercises are often isometric.
Isometric.
Meaning your muscles work, they tense up, but your joints don't really move through a range of motion. It's about holding positions.
Okay.
And the focus is on stretching those muscles that are tight, resistant. They're also really careful about the specific angles used in the exercises.
Oh, the angles.
To make sure the target muscles are doing the work, you see. And to stop stronger, dominant muscles from just taking over, which can often happen.
So it's quite precise.
Very precise. The first session was basically this assessment and testing phase. Then each person got 8 one-hour sessions twice a week for 4 weeks, all individually administered by a therapist.
Wow. Okay, so quite intensive and very personalized. What about the other group? The generic exercises.
Yeah, their program was, more general, focused on lengthening and strengthening the big muscle groups involved in back support. The posterior and anterior chains, adductors, core muscles.
Like standard stuff you might get from a physio.
Kind of. Things like bridging exercises, hamstring stretches, that supine cycling thing where you pedal in the air lying down.
Yeah.
Lower ab crunches, planks, seated inner thigh stretches, kneeling quad stretches. A mix of common exercises.
And how often did they do it?
Same structure. 8 one-hour sessions, twice a week for 4 weeks, also individually supervised. Their sessions were typically stretch, strengthen, stretch again.
Gotcha. So same duration and frequency, but different types of exercises. How did they measure if it worked?
They used 2 main tools, both pretty standard. One was the Rowland and Morris Disability Questionnaire.
But that's where people rate how back pain affects daily tasks.
Exactly, like walking, bending, sleeping. The other was a 100-millimeter visual analog scale for pain.
The line scale, right. Mark how bad your pain is from 0 to 100.
That's the one. Simple, but effective. They took these measurements before anything started baseline, then right after the 4 weeks of exercises, and then again 3 months later.
Oh, good. A follow-up to see if it stuck.
Yep, to check for longer-term effects. And just for context, participants were randomly assigned to groups, and the study had ethical approval. They also suggested home exercises, but they didn't formally track if people actually did them.
Okay, right. Important detail. So we understand the setup. Let's get to the juicy part. What did they actually find? What were the results?
The results were, well, pretty striking, actually. Looking at pain relief, the Canali Postural Method group reported significantly more pain reduction. Yeah, and this held true both immediately after the 4 weeks and at that 3-month follow-up point.
Okay, wow. Do we have numbers?
We do. The average pain score on that 0 to 100 scale in the Canali group dropped from around 65 down to just over 23.
That's a huge drop.
It really is. And importantly, that change was bigger than what doctors consider the minimal clinically important difference for this type of low back pain, meaning it's a change that patients themselves would likely notice and feel is significant.
And the control group, the generic exercises.
They also saw some pain reduction, which is good, but it just wasn't as much, and the difference wasn't as statistically robust compared to the Canali group. You see that pp 0.001 value mentioned in the study.
Yeah, what does that mean again?
It basically means there's a very, very low probability, less than 1 in 1,000, that the difference they saw between the groups was just due to random chance. It suggests the finding is highly reliable.
Okay, so strong evidence for better pain relief with the Canali method. What about the disability side? How much it interfered with life?
Interesting results there, too. Right after the 4 weeks, both groups felt less disabled. So both interventions helped initially.
That's positive.
It is. But when they checked again at the 3-month mark, the Canali Postural Method group maintained their improvement better. They showed superior improvement in perceived disability compared to the generic exercise group at that later time point. Again, statistically significant.
So maybe more lasting effects on function, too.
That's what it points towards, yeah.
And you mentioned everyone showed up for their sessions.
Yep, 100% attendance in both groups. So people were clearly committed, regardless of which program they were in.
Okay, so based on these findings, what are the bigger implications here? Why should we, pay attention to this?
Well, if you think about it, the significant improvements, especially the lasting ones with the Canali method, could be a really valuable tool, not just for easing pain, but for improving motor control, how you move, and ultimately quality of life.
And you think it could apply beyond just low back pain?
The researchers suggest that, yeah, because it focuses on correcting underlying musculoskeletal imbalances in posture, the principles might well help with other issues, neck pain, shoulder problems, maybe even hip or knee issues stemming from poor posture.
That could be huge, considering how common those are, too.
Exactly. And think about the burden of low back pain socially, economically. If we have an effective non-drug approach like this, it could potentially lead to, lower healthcare costs.
Right. Fewer doctor visits, maybe less need for imaging.
Less reliance on treatments that have risks, like long-term opioid use or even surgery in some cases. Plus, people feeling better means potentially more productivity, less time off work.
There's also that interesting potential link you mentioned earlier between posture and how we feel about ourselves.
Yeah, that's a fascinating angle. The idea that improving your physical posture, standing taller, moving more efficiently, might actually foster a more constructive mental posture, too. Maybe boosting feelings of confidence, self-efficacy, just overall well-being. It's not the main focus of this study, but it's an interesting potential side benefit.
Definitely something to think about. But, okay, let's bring it back down to earth a bit. Every study has its limits. What were the limitations here we should be aware of?
Absolutely crucial to talk about these. So first off, they recruited people using social media.
Which might mean?
It might mean the people who signed up were maybe already more proactive about their health or more comfortable with online stuff, so they might not perfectly represent everyone with non-specific low back pain. There could be a bit of selection bias.
Okay, that makes sense. What else?
The sample size, 35 per group, while enough to show the differences they found, is still relatively small in the grand scheme of things.
Yeah.
And again, it focused only on non-specific low back pain. We can't automatically say it works for back pain from, say, a disc herniation or arthritis without more research.
Got it.
Another point is the reliance on self-reports. The questionnaires for pain and disability are standard, yes, but they are subjective. There weren't any objective physical measurements of change, like range of motion or strength tests recorded as outcomes.
So we're relying on what people said they felt.
Pretty much.
Yeah.
And remember the home exercises, they were suggested, but adherence wasn't tracked. So we don't know how much, if any, impact that might have had.
Yeah.
And a big one in this kind of research blinding. The therapists knew which treatment they were giving. You can't really blind someone to whether they're doing highly specific postural exercises versus generic stretches. This lack of blinding means there's a possibility of unintentional bias, maybe in how enthusiastically the therapy was delivered, or even subtle cues influencing participant responses.
Okay.
Also, the time frame. 4 weeks of treatment and a 3-month follow-up is decent, but maybe not long enough to see the really long-term picture. And finally, that key difference. The Canali group got that personalized assessment, which drove their exercise selection. The control group got a generic plan. That personalization itself could be a major factor in the better results, separate from the specific types of exercises.
So lots of important caveats to keep in mind when we look at the promising results. Did the actual researchers or the method's creator comment on the study?
Yes, we have a few statements. Vincenzo Canali, who created the method, said he sees this study as a really important step in getting scientific recognition for their approach. His goal, he says, is to help people get back lasting postural and functional balance.
Understandable perspective from the creator.
Then Antonio Giordano, one of the co-authors, stressed how important it is to scientifically test these kinds of methods. He thinks the Canali Postural Method looks like a really promising way to tackle what he called a significant social and economic problem.
Okay.
Saverio Sabina, the lead author, mentioned their drive is to experiment with solutions for well-being and find effective answers for chronic low back pain, given its huge impact.
So a real focus on finding practical solutions.
Seems like it. And finally, Patrizia Majorano, a physiatrist that's a doctor specializing in physical medicine and rehabilitation, and another co-author, she described the method as a technique capable of supporting pain resolution and functional recovery when overload and postural issues are involved.
So generally positive and hopeful views from the team involved. As we wrap this up then, what's the kind of final thought or question we should leave our listeners with?
Well, it really brings up this fascinating question, doesn't it? We know posture affects us physically, but thinking about that potential link to self-perception too, it makes you wonder, how might a more personalized root cause approach to exercise, like this Canali Postural Method seems to be, change how we treat these really common muscle and joint issues? Should we be focusing more on addressing the why behind the pain, the specific postural imbalances, rather than just general strengthening or stretching? It encourages you to think about that potential for lasting relief, better quality of life, and maybe even looking into practitioners or resources that focus on these kinds of detailed movement-based assessments.
Right. So the main takeaway really is that this specific method, the Canali Postural Method, showed some quite promising science-backed results for improving low back pain and disability, especially when you compare against more general exercises, at least in this particular study group.
Exactly. And hopefully, by pulling together the info from the news report and the actual scientific paper, we've given everyone a clearer picture of what this approach involves and what the research found.
We certainly hope this deep dive has been useful, shedding light on a potential new way to think about managing a health issue that touches so many lives.
Yeah, maybe it sparks some further thought or exploration on your own.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.